Hello, I'm Dr. Paul Karpecki. Today I'm going to take you through a technology I'm extremely excited about known as the MuCheck. It's a wonderful mybography system that's very simple, but also a great patient education tool. Beyond that, it also is not only is it important as mybography, it takes into account the data, allows us to do a symptom score on the OSDI-6, which gives us a lot of the key symptoms related to dry eye, and allows me then to take it and educate the patient, give us a grading of where they're at based on the PULT score. That's a MIBO scale, as is listed here, but Dr. Pult has done a lot of the work in terms of creating this and validating it, and so we're lucky to get to present this to you today. All right, I have one of my technician assistants here, Stacy, who's going to take us through the process, and our patient, Michael, here today. So let's select the patient, and we're going to do mybography. This is called the MIBO scale, as we talked about. And you can see the red outline lines up beautifully with the lower eyelid in terms of where your meibomian glands would be. The lights in the pupil are typically what the patient is also seeing. That's a targeting mechanism for them to look at it, to be centered, and to look in that center area. As you look at our alignment, we also have a red light that helps us line up the pupil, or the center of the eye itself. And there's a perfect lineup for the right eye. Now, one of the great things about this technology, as simple as it is they provide you a little tool to help flip the eyelids. So you want to line up the red outline just below the lash line, so that when you use this nice tool that they provide to invert the eyelid, you place the tool underneath the eyelid line as you have there on the lashes, and then just flip. Now we see the meibomian glands in focus. We see that they're within that red outline. We can press save and proceed. Here now is we're able to adjust contrast. We can move it up or down based on where we want to place it to enhance the image that we're there very quickly and very easily. As you can see now, we have kind of a nice outline of the meibomian glands. You can see the areas where we have gray that are missing, and this tells us, roughly how that compares to nice imaging down below, so you can assess that. All right, now we'll switch over to the left eye. Once again, you can see that red outline of where the meibomian glands are going to be located when everting the lower eyelid needs to be placed under the lash line in order to get likely imaging, because as you lower that lid, it also lowers slightly. So it gets very easy for a technician to do this. It takes very little training. So that is placed now right below. The eyelid is flipped, and as you can see, it's right in that ideal placement area. That is then captured. At this point, we're able to, once again, vary the contrast once we have our image in place. And again, depending on your Wi-Fi, this can be very quick in terms of its ability to take the image and put it in place. Once again, you could get a great view here of the meibomian glands. You could differentiate them quite readily. You can see they're completely intact, nice slate of glands. A couple areas of gland loss, but very subtle and not as significant. Once again, we can go through the various scales. In this case, it's less than 25% gland loss, so that's a degree of only 1. Let's save that, and this gives us the opportunity to now do the OSDI-6. So in this case, I'm going to ask the patient, have you experienced any of the following during a typical day of the last month? Eyes that are sensitive to light, constantly, mostly, often, sometimes, or never.
Sometimes.
Blurred vision, constantly, mostly, often, sometimes, or never.
Sometimes.
Have problems with your eyes limited you in performing any of the following during a typical day of the last month? Driving at night?
Sometimes.
Watching TV?
Often.
Have your eyes felt uncomfortable in any of the following situations during a typical day of the last month? Windy conditions?
Often.
Places or areas with low humidity?
Often.
Thank you. That was really it. It tells you that in terms of your symptoms, you're a level 2 in terms of dry eye severity based on the Dr. Pult and Professor James Williamson scale. And one of the great things here, we'll put in, of course, the patient's information and go through that. But one of the things I really like is at this point, I could use that information for a number of things. One, it gives me a grading of the patient's symptoms and signs. Number 2, I could send that into my EHR, so we lock it in. And the third thing that's extremely exciting is that I can actually take this device, which is like essentially a tablet. I'm able to bring up the images and use it as a teaching tool in instructing my patient. Because Michael, I think now I can show you your mybography images. And what I'll do here is I'll just explain to you what they should look like. In actuality, what we're seeing, and these are very healthy meibomian glands. You see there's an entire array of glands. That's a really good sign. These little dark areas, though, tell me that there's likely some stress on these glands. So this would be a good case where we would want to take perhaps some preventative measures to ensure your meibomian glands continue to function. And many times we see symptoms present before the signs. And keep in mind that even though you have an entire array of meibomian glands, and it's so important to know what they look like, their function is also key. Right now I want to take you through another feature in this technology of MeCheck, which is the ability to image up to 1,000 times, not that you'd ever go to that level of magnification, but you could if you're really trying to isolate a lash or two or show perhaps Demodex collarettes that are present in blepharitis. And here in this patient, as you can see, we have the imaging of the lashes. You can see at the base of the lashes some mild areas that may show some mild blepharitis, typical collarette kind of appearance, but not a lot. These are overall very healthy lashes. And really, that's it. This simple. You line it up just like a camera. If you come around here, you can see how the features of this are. It's just simply placed directly straight ahead. You have the patient look slightly down. That seems to work best for our imaging. And it's just designed perfectly in terms of the amount of light that's present. You can adjust the LED as needed, and that we've already done to maximize our image, but you can see there what level to do it. And because it's LED, you get this very sharp contrast within the lashes, just as you see here. And then we save and proceed. And by proceed, we have a lot of options. I could email this to the patient, or we could put it in our EHR as an anterior segment photograph, which is billable, especially in this case, given the symptoms that we captured in the OSDI-6. So excellent technology, both for meibography as well as for external eyelid imaging. So you're able to completely capture blepharitis, whether it's MGD or external eyelash blepharitis.